1, 2, 3.
For 82-year-old Louise DeVoe, getting the flu vaccine isn't just about protecting her health.
Thank you.
Let me just put a Band-Aid.
I have to protect myself and my family and my grandchildren and the person next to me. I don't want to make them sick either.
Ontario bought more than 7 million doses for this year, and DeVoe is one of the million considered high risk who have already received one. But the high risk group also includes children.
I worry a little bit that there are probably some families who are not as eager to get the flu shot because, last year seemed to be such a trivial flu season.
Last year in Canada, only 69 lab-confirmed cases were detected for the whole season, compared to the yearly average of 52,000 cases over the previous 6 years. But health experts say since then, public health measures have eased.
In our own city, in our own province, you can have indoor gatherings with 25 people. And we know that it's those indoor settings, as the weather gets colder and we move indoors, that is how flu spreads.
More evidence? Other viruses are coming back.
Given that we are already seeing those respiratory illnesses and outbreaks in daycares, which we didn't see last year, there is no reason to believe that the flu virus won't behave the same way.
In British Columbia, the flu vaccine will be free for everyone this year over the age of 6 months. With COVID-19 in the balance, healthcare officials say they don't want a so-called twindemic.
The concern is that if we have more people sick with flu at the same time as we have people sick with COVID, the healthcare system could really be overburdened.
Health Canada says so far only 12 confirmed flu cases have been reported. The question now, how much will that change? Tashana Reid, CBC News, Toronto.
Okay, now we have joining us Dr. Zain Chagla, infectious diseases specialist. So, Dr. Chagla, there's the kind of flu prevalence that we saw pre-pandemic. Then there was the dramatic low of last year. How bad do you expect this winter to be?
Yeah, I think it's going to be somewhere in between. So I don't think we're going to have a flu season like 2020 or 2021 where we really didn't have a flu season. But when we look to other places in the world, they have seen flu activity, and recognizing what kept flu away here in Canada, well, lockdowns, travel restrictions, very severe capacity limits, schools being closed in some regions. And so many of those things go back on the table. It's going to be hard to contain the flu, especially as people start bringing it back into Canada.
And, for someone who, let's say, normally doesn't get the shot, even pre-pandemic, what would you say to them? I mean, what's new this year that you think should convince them?
Yeah, I mean, obviously the healthcare capacity is something in mind. But remember, we still live in a society where, if you get flu-like symptoms, you need a COVID test. If your kids get flu-like symptoms, they need a COVID test. And so it's not just the hospitalizations, it's the absences, it's the testing, it's overwhelming the system. And so, this is the one preventable respiratory tract infection we have out there. It does a whole lot better to society to reduce that burden of absences if people get the shot.
Dr. Chagla, always good to talk to you. Thank you so much.
No problem.